Hey, it's Jess and it's really early, apparently, where Matthew Holt is compared to where I'm at.
Where are you, Jess? Why am I up so early in the morning? What's going on? Why did I even get a chance to get dressed?
Oh my God, you couldn't even be bothered to put a shirt on. Matthew, I can't be bothered to put a shirt on Holt.
Okay, I'm in California. It's early in the morning. Jess, you're not here.
I'm in Salerno, Italy, visiting the Palazzo Innovazione, run by Roberto Ascione.
Oh, you're in the whole Italiano thing. It's a European in the May and whatever, and must be about time. You just going to dinner, or you just go to the back of when did?
Oh no, we're not going to dinner until 8. It's only 7.
Oh, okay. Well, I better get on with the Sawan. Then the hands away.
Oh my God, let's get on with this.
So what are we doing here?
Health in 2.0. Oh. Okay, basta with all of this. We're done. Finito.
No more silly Italian accents. No more early morning jokes.
Italian accents. I'm done.
I'm not going to go get dressed. Let's just get this thing out of the way.
Unleash. Yeah, you're not going to get dressed. We'll talk to you at 2 in the afternoon. You'll still be wearing that. Don't even pretend. All right, set your timer. Let's go. Andiamo.
Andiamo.
Here we go. Ready? All right. We're going to start with a uBiome update because the last time we talked about this, I was getting on a plane. So what has happened?
Well, they really ended up in some serious shit. Apparently, they've been multiply billing illegally many different insurance companies who are all after them. CEO Jessica Richmond and some other senior officers all put on gardening leave, and I think it's probably may not be survivable for them.
Ugh. We'll see what happens. In better news, Noom, the nutrition chronic disease management platform, raises $58 million. That's a whopping amount of money.
Yeah, Noom is sort of going into the MyFitnessPal, Weight Watchers space of basically diet management. Well, they've got some different things there. And they are running a whole bunch of TV ads, which anybody who's watching basketball at the moment is seeing a lot of. And if you're going to run a lot of TV ads and go direct to consumer, you've got to spend a whole lot of money to do it.
Okay, so this is cool. DispatchHealth, which is like a clinician house call platform, raises $33 million. I kind of like this.
Yeah, this is interesting. There's another one called Heal, which we've had at Health 2.0 a couple of times in this very competitive space. I think Heal's raised, 50 or 60 million, I forget the number. But this is interesting, is can you actually justify the cost of sending a doctor to the house? I have a hard time believing it, but if you look at Devoted Health and some others, they're doing something somewhat similar, around very sick people. It's going to play out different ways of delivering care in different places.
What about the Kaiser Unite Us deal? I didn't really catch this one, so tell me what it was about first.
Unite Us recently raised a whole bunch of money. You raised, I think, around 50-odd million from OHCF and Lyncho O'Keefe, now Define, ex of Planet Perkins, and some others. And what's going on there is that they are basically taking all those social determinants of health stuff, all the social stuff that you need, if you're in a healthcare situation, such as social work and whatever.
Did it go?
It's gone. We're off. Didn't make a noise, but we're off. Anyway, so
one more.
And what they're doing is they're going to integrate that into their EHR. So what it basically is going to mean is that when a doctor, wants to prescribe something like, I don't know, healthy vegetables or social work or whatever else, they can now do that in the context. And all those, there are a bunch of other companies like
Zelf. Isn't Zelf one of those?
Alphify, and so there are some others doing the same kind. Zelf is doing
a little bit different,
but there are a whole bunch of people doing this social determinants of health stuff, and it's becoming a screamingly big deal. Andy Slavitt from Downhill Ventures, who I think is one of the investors in Unite Us, is been banging this gone great loudly. So there'll be more and more thinking about how do you integrate the whole social determinants of health and stuff to actually deal with those issues into the mainstream of healthcare, and it's a big example.
Cool. Awesome. Busy week while I wasn't there.
Well, those of you lying on the beach doing yoga and Pilates or whatever.
I was.
And hang on, what the hell are you doing in Italy now? You hanging out with Roberto Ascione from Healthware?
I am, from Healthware International. And the Frontiers Health team, and we're talking about super secret stuff. And then I'm headed to Webbit next in Sofia, Bulgaria.
Hang on. So now you're in Italy plotting world domination with Roberto, and then next week you're going to Webbit with Is that with the Bayer guys? And it's Shafi
Yeah,
Ahmed?
all our Bayer friends, and Shafi Ahmed will be there, and Plamen Rusev is the guy who organizes that whole festival. And I went last year; it was really cool. It's kind of like the Eastern European version of South by Southwest. Is how I would describe it. So, looking forward to that again. There was a lot of lasers. There were a lot of lasers.
Lasers, South by East in Bulgaria. Well, that'll be fun.
Well, yeah.
Are you ever coming back to America, Jess, or will we lost you to Europe for the summer again?
No, I will be back at the end of May.
Aha, but are you going to come to Health 2.0? I know you are. Health 2.0 in June in Helsinki.
Yes. Mm-hmm. So I'm going to
make a trip to Helsinki again.
My apartment, change my clothes, and then come back. So yeah, that's it. And now you know the world travels of Jessica DeMoss. All right, Matthew. Well, I will catch you soon, and everybody else. Thanks so much. Please be sure to check out our YouTube channel if you've missed any episodes up until this point. Just search Health in 2.0. Or if you want these delivered to your inbox, because lots of people say to me, we love to watch this, but I can never find it. So just subscribe to the Healthcare Blog's e-newsletter, and this loving little episode will be baked right into it, so you don't even have to worry about it. To do that, you go to thehealthcareblog.com and just click subscribe to the e-newsletter, and then you'll get it, and that's it. Right? Right? Maybe you can get a shirt, or if a sponsor wants to send one, we'd gladly take it. All right, Matthew. I'm Jessica DeMassa. That's Matthew Holt. Thanks so much for joining us. Talk to you guys soon.